നമസ്കാരം. പുതിയൊരു വീഡിയോയിലേക്ക് പുതിയൊരു ഓൺലൈൻ ക്ലാസ് എന്ന് പറയാൻ പറ്റില്ല, റീഡിംഗ് അതിലേക്ക് സ്വാഗതം. ഓക്കെ, സോ ഇനി അടുത്തത് നമുക്ക് പറയുന്നത് കീ ഫൈൻഡിങ്സ് ഓഫ് ദ GHI എന്ന് വെച്ചാൽ ഗ്ലോബൽ ഫൈൻഡിങ്സ് ആണ്. ഗ്ലോബൽ ഹങ്കർ ഇൻഡെക്സ്. ഓക്കെ, ഹങ്കർ ലെവൽസ് ഇൻ 42 countries are at alarming levels, making goal of zero hunger by 2030 at this place of progress will not even attain a lower hunger level until 2160. World such GHI score is 18.3, which is considered moderate in the severity of hunger scale. Report highlights link between gender inequality, climate change, and hunger. Gender is intertwined with climate and food security challenges in ways that respective policies and interventions often ignore. Women and girls are typically hardest hit by food insecurity and malnutrition. They also suffer disproportionately from the effects of weather extremes and climate emergencies. India-related findings. India ranks 105th out of the 127 countries, okay, up to 111 in 2023, falling under the serious category with 41 other nations, including Pakistan and Afghanistan. India's GHI score is 27.3. Okay, India's GHI score has fallen since 2000. However, child wasting and stunting remains very high. Remain very high. Okay, child undernutrition in India goes hand in hand with the poor nutritional status of mothers, underscoring need for attention to maternal health and nutrition. However, according to the experts, global hunger index continues to be an erroneous measure of hunger with serious methodological issues and shows malfied. Some of the issues highlighted by experts are key issues with the GHI methodology. 3 out of 4 indicators used for calculations of index are related to health of children and cannot be representative of entire population. Child stunting, wasting, and under 5 mortality are outcomes of complex interactions of various other factors like drinking water, sanitation, genetics, environment, and utilization of food intake apart from hunger. Okay, faulty indicators. Studies challenge the use of stunting as an indicator for undernutrition, showing it occurs in well-nourished populations as well. Okay, outdated data sets. Okay, source of data used to construct global hunger index is outdated and far from convincing. For example, the National Family Health Survey (NFHS) data on stunting wasting is under the 5 years. Children are not available annually, but every 8 to 10 years. Okay, small sample size. Okay, the indicator of proportion of the undernourished POA population is based on an opinion poll conducted on a very small sample size. Okay, the report lowers India's rank based on the estimates of the POA populations for India and 16.3%. Factors behind the hunger crisis conflict. Almost 70% of the 309 million people facing acute hunger are in fragile or conflict-hit countries. Violence or instability in Middle East, Central and West Africa, as well as in the Caribbean, South Asia, Southern Asia, and Eastern Europe are particularly concerning. Okay, next we have about the global hunger index scores. The global hunger index (GHI) is a tool for comprehensively measuring and tracking hunger at a global, regional, and national levels. GHI scores are based on the values of 4 component indicators: undernourishment, the share of the population with insufficient caloric indicate, child stunting, the share of children under the age 5 who have low height of their age, okay, reflecting chronic undernutrition. Okay, child wasting, the share of children under the age 5 who have low weight for their height, reflecting acute undernutrition. Okay, child mortality, the share of children who die before their 5th birthday, partly reflecting the viral mix of inadequate nutrition and unhealthy environment. Data back, according to JD, 37.7% of Indian population suffers from undernutrition. 35.5% of children under the age of 5 are standard. Okay, 18.7% experience child wasting, and 2.9% of the child do not reach their 5th birthday. Next we have conflict disrupts food production, forces people from their homes and source of income, and often hinders humanitarian access to people in most needy. Climate crisis is one of the leading causes of steep rise in global hunger. Climate shocks, example, drought destroys lives, crops, and livelihood, and undermine people's ability to feed themselves. Poor economy, sluggish global growth, and economic stresses linked to slow pandemic recovery and fallout from the war recurring continue to affect low and middle income countries. Displacement, forcibly displaced people face specific vulnerabilities in relation to food insecurity, including limited access to unemployment, livelihood, food and shelter, and reliance on dwindling humanitarian assistance. Example, Darfur area in Sudan. Okay, factors behind prevalence of malnutrition in the urbanization reshapes food systems, diets and lifestyles. It increases access to cheap, ultra-processed foods and beverages, promotes sedentary behaviors. According to the Euromonitor International 2019, the sales of processed foods in India almost doubled between 2012 and 2018. Undernourished mothers, most Indian women are anemic, and poor women and undernourished mothers gave birth to undernourished babies. The prevalence of anemia, according to the National Family Health Survey 5, is 57.8% women, 15 to 49 powers. Okay, yes, okay, 59.1% is adults, 52.2% is pregnant women. Okay, low education level and socio-economic status. Children born to the mothers with enough schooling and children in the lowest wealth quantile are most likely to be undernourished. Vulnerable sections, children from other backward classes, obviously have highest minimum dietary diversity failure to 79%, followed by the scheduled caste 77.2% and scheduled tribes, okay, to 70.7%. Okay, initiatives taken for tackling hunger in India. Pradhan Mantri Garib Kalyan Anna Yojana (PMGKY) launched to provide food grains for free of cost 18 crore for. Okay, Pradhan Mantri Madhur Mandana Yojana registered women are provided rupees 5,000 on the worth of their first child for wage support and nutritious food during pregnancy and post-delivery period. Okay, portion of the National Nutrition Mission aims to achieve improvement in key nutrition parameters to children and women. Eat Right movement aims to transform the country's food security to ensure safe, healthy, and sustainable food. Integrated Child Development Scheme (ICDS) supplementary nutrition is one of the 6 services provided under the ICDS. It is intended to primarily to bridge the gap between recommended dietary allowance and average daily intake. National Food Security and NFSA 2003. The NFSA is an act of the Parliament of India intended to provide subsidized food grains to approximately 2/3 of India, 1.2 billion people. Recognizes the right to food as a statutory right. Initiatives taken for tackling global hunger. Okay, SDG 2 Zero Hunger. It aims to end the hunger, achieve food security and improved nutrition and promote sustainable agriculture. World Food Program, Food Assistance Branch of the United Nations, established 1961. Its mission is to combat hunger worldwide by providing food aid, promoting food security and enhancing nutrition. Zero Hunger Challenge, an initiative by the UN Secretary General that invites countries to work towards a future where everyone has access to adequate nutrition. Rome Declaration of Nutrition. Declaration commits countries to eradicate hunger and prevent all forms of malnutrition worldwide, particularly undernutrition in children, anemia in women and children, among other micronutrient deficiencies. Food and Agricultural Organization of the United Nations (FAO) aims to ensure people have regular access to enough high quality food. Okay, conclusion. Policy recommendations made in the document include strengthening accountability to international law and the enforceability of the right to adequate food, promoting and gender transformative approaches to food systems and climate policies and program, and making investments that integrate and promote gender, climate and food justice. Okay, National Health Accounts estimates. Why there is recently Union Minister of Health and Family Welfare (MOHFW) released National Family Health Accounts estimates for the fiscal year 2020-21 and 2022. Okay, but National Health Accounts estimates (NHA) estimates released by MHFW since 2030-24. NHA for India was envisaged in National Health Policy 2002. The NHA offers a detailed description of the financial flows within the India's health system, illustrating how funds are collected from various sources, how they are spent across the healthcare sector, and how healthcare services are utilized. NHA estimates are derived within the framework of National Health Survey Health Accounts Guidelines for India 2016 and prepared by using a system of health accounts 2011. National Health Accounts Technical Secretary NHATS prepared by the NHA estimates with the constant guidance and support from NHA Steering Committee and NHA Expert Group for India. System of Health Accounts System 2008 is a global standards of framework for producing health accounts and facilities comparison of estimates across countries. It provides a standard for classifying health expenditure according to the 3 axes of consumption, provision, and financing. It is a result of joint cooperation among Organization for Economic Cooperation and Development (OECD), World Health Organization, and Eurostat. Key findings of NHA estimates for India: health indicator, total health expenditure (THE) as percent GDP per capita trend in 2021-22 since 2017-28. Okay, and detail. The THR percent of GDP increases 3.83% from 3.31%. Per capita increase to rupees 6,602 from rupees 4,297. Okay, the constitutes current and capital expenditure incurred by government and private sources, including external funds. THS as a percentage of GDP indicates health spending related to the country's economic development. The THC per capita indicates health expenditure per person in the country. Government health expenditure GHG as percent has increased to 48% from 48.8%. GHG considers spending under all schemes funded and managed by the United States and local governments, including quasi-government organizations and donors in case funds are channeled through government organizations. Current health expenditure CHG as the percent of GHG decreased to 87.3% from 88.5%. CHG constitutes only recurrent expenditure for healthcare purposes, and all capital expenditure. CHG as percent of the DHG indicates operative expenditure on healthcare that impact health outcomes of populations in the particular year. Okay, out of pocket expenditures on healthcare. Okay, OOP as percent of the DHG decreased to 48.8% from 64.2%. OOPR expenditures directly made by households at the point of receiving healthcare. This indicates extent of the financial protection available for households towards the healthcare payments. Okay, social security expenses SSC on health as percent of the DHG. Okay, decreased to 8.7%. It was from 9%. SSC includes government funded health insurance scheme, PMJAY, RSBY, etc. Social health insurance programs and medical reimbursement to government employees for healthcare purposes and social health insurance schemes expenditures. Private health insurance expenditure PHI as percent of the DHA increased to 7.5% from 5.8%. PHI constitutes spending through health insurance companies. External donor funding for health as percentage of the DHA increased to 1.1% from 0.5%. It constitutes all funding available to the country by system donors. Conclusion: the ongoing healthcare reforms will pave the way for a wealthier, more equitable future for all citizens. Increasing healthcare spending plays a crucial role in the strengthening healthcare infrastructure, expanding testing and treatment facilities, and plays a critical role in addressing pandemics like COVID-19 in the future. Digital health. While the Ayushman Bharat digital mission ABD launched in 2021 marks 3 years towards enabling digital health. About Ayushman Bharat digital mission ABDM aims to connect the digital health solutions of hospitals across the country. ABDM as a digital ecosystem will also enable a host of other Other facilities like digital consultations, consent of patients, key users, inclusivity, free of cost registration, opting out of the ABDM ecosystem as per one's will. Okay, single source of truth with no other parallel copies of one's medical records federated structure to ensure privacy, voluntary participation, implementing agency, the National Health Authority, and attracted and attached office of the Union Minister of Health and Family Welfare. Components of ABDM architecture, Ayushman Bharat Health Account ID. Okay, a unique 14-digit number to store and manage health records. Okay, healthcare professionals registry HPR. A unified repository of healthcare professionals across all medicine, health facilities, HFR, repository of health facilities of the nation, both public and private health information exchanges and concern manage HIA and CM to ensure that data exchange is run by uniform access. Concern unified health enterprise UHI to facilitate discovery and delivery of health services, national health claims exchanges, SCX to standardize the insurance payment ecosystem. Okay, about digital health, that is the WHO defines digital health as a field of knowledge and practice associated with the development and use of digital technologies to improve health. It includes digital health applications, electronic health records, telemedicine, wearable devices to monitor health aspects, and health information systems for managing, storing, and exchanging health information. Okay, digital health technologies, AI, and big data to quickly identify variants in tremendous volumes of data, Internet of medical things, okay, interconnected medical devices, augmented reality to make medical procedures more efficient, digital ecology, genomics, etc. Significance of promoting digital health, okay, seamless medical record sharing enables Indians to use ID-enabled tools to share prescriptions, blood test reports, and X-ray diagnostics with the doctors. Okay, a personalized medical account creates a unique health ID for every citizen and digital history to facilitate seamless interactions between healthcare experts. Okay, chronic disease management helps manage chronic diseases which have become a critical public health challenge in the past 15 years. Also improve public health monitoring and advance evidence-based policy making in the long run. Enhance treatment for critically ill patients. Data portability could expedite treatment of critically ill patients, okay, especially those suffering from multiple ailments. Okay, comprehensive medical history repository alerts doctors to patients' medical history with one click. Important for rating patients with the comorbidities as highlighted during COVID-19. Also gives patients options to choose which records they want to share with the healthcare providers. This ecosystem will ensure all the medical records are not lost as every record will be stored digitally. Okay, concerns pertaining to digital health privacy and security issues. Unauthorized data access and breaches can compromise patient privacy and lead to identity theft. Okay, except personalized data collected can be exploited by insurance companies and pharmaceutical firms to be for targeted advertisement. Okay, algorithm bias technology such as AI can result in unfair or discriminated treatment. Example might lead to racial and ethnic disparity in healthcare. Okay, equity and access issues. Okay, equal access to digital health technologies and digital literacy skills can explore vulnerable population. Poor internet connectivity in rural areas can make it a data entry and utilization of digital healthcare services as a challenge. Okay, next we have the benefits for citizens registering in ADBM. Paperless health records accessible anytime, anywhere. Okay, citizen will be able to access healthcare digitally through teleconsultation using apps integrated with the ABDM. ABDM achievements, digital health ideas and records. ABDM has generated 67 core Ayushman Bharat health records and linked 42 crore health records. Healthcare facility integration. The initiative has integrated over 1.3 lakh healthcare facilities, including 70,000 private sectors. Private sector participation, more than 236 private entities comprising laboratories, pharmacies, and digital solution companies have joined the ABDM ecosystem. ABDM key initiatives: QR-based operation department (OBD). It reduces waiting times, enhancing efficiency and accuracy. Digital health incentive scheme. DHI's financial incentives of up to 4 crores to boost digital health adoption, while micro size for private sector adoption aimed at addressing challenges in ABDM adoption. Okay, next, a lack of trust in the digital healthcare system. Example, the failure of the UK's National Health Service digital system highlighted are the importance of earning the trust of healthcare providers. Lack of standardization in digital cards. Okay, India struggles to standardize the coverage and quality of existing digital cards. Example, one nation, one ration card, PMJAY card, Aadhaar card, etc., leading to data migration and transfer issues, as well as the concerns over data security, communication challenges in diverse healthcare ecosystem. Due to its linguistic and cultural diversity in a way for enhanced universal reach, ensure the intelligent health solution is elevated across a diverse user base, including displaced populations and diverse racial or cultural backgrounds, to improve quality of life and collaborative decision-making, strengthen technical proficiency, improve digital skills among medical teachers and students to better leverage digital health tools. Enhanced targeted solutions create a customized and individualized approaches to digital health tools supported by empirical evidence. Build ethical oversight. A formal governance body can be established to develop framework for data collection, sharing, and usage, and draft a code of ethics. Finish in short, UN Women released a World Survey on the role of women in development report. The theme of the report is harnessing social protection of urgent gender equality, resilience, and transformation. It takes stock of progress caption challenges in building comprehensive gender responsive social protection system. Need for gender responsive social protection (GRSP). Gender responsive approaches for social protection actively seek to respond to gender specific risks, vulnerabilities, and constraints such as women's lesser access to resources, disappropriation responsibility for unpaid care and domestic work, gender-based violence, and lack of violence in decision making. GRSP approaches acknowledge the nature of intensity of risk and constraints based on gender. Key findings of the report: the 2 billion women and girls lack access to any form of social protection such as cash benefits, unemployment insurance, pensions, or healthcare. Okay, over 60% of the women globally still give birth without access to maternity benefits. Okay, gender-specific risk or vulnerabilities are exacerbated by factors like conflict, climate change, and economic shocks. So, key recommendation address gender gaps and biases in existing social protection systems, policies, and programs. Okay, improve coordinations with gender responsive employment policies and public services. Adapt social protection policies and programs to meet the needs of women and girls during this sudden and protracted crisis. Takes a rights-based approach to social protection delivery. Next, we have the initiative taken by the India for Women's Social Protection. Okay, Mahatma Gandhi National Rural Employment Guarantee Act 2005. And aims to provide at least 100 days of guaranteed wage employment per year. Pradhan Mantri Madhur Vandana Yojana (PMAY) provides financial subsidies to pregnant and lactating women. Okay, lactating women. Pradhan Mantri Ujjwala Yojana (PMAY) to free LPG connections to people households to protect women from health hazards. Okay, e-migrate portal. Minister of External Affairs and Minister of Labour Employment launched the e-migrate portal and mobile app. About e-migrate portal, online platform to facilitate and manage the migration of Indian workers seeking employment abroad. Next, we have the aims to provide various services to migrant workers, including information access, documentation, helpline, support, etc. Features of 24/7 multilingual helpline and will be integrated with the DigiLocker for secure document storage and obtain paperless clearance and immigration. Okay, it also brings foreign employers, registered recruitment agents, and insurance companies on one common platform designed to promote a safe and legal migration. PM Yasavi, okay, Minister of Social Justice and Empowerment, highlight the impact of PM Yasasvi, PM Young Achievers Scholarship Award Scheme for Vibrant India Initiative. About PM Yasavi, obviously streamlined educational support for socially and economically disadvantaged students. Okay, it is an umbrella scheme that aims to provide quality education to students from other backward classes, economically backward classes, EBCs, and denotified tribes, DATs. Okay, it is subsumed early initiatives like a Dr. B.R. Ambedkar's post-matric scholarship scheme for EBCs and NDNTs. Okay, governments extend supply of fortified rice across welfare schemes until 2028. Free fortified rice will be supplied under the Pradhan Mantri Garib Kalyan Anna Yojana (PMGKY) and other welfare schemes. Okay, rice fortification involves adding fortified rice kernels containing micronutrients like iron, folic acid, and vitamin B12 to normal rice custom milled rice as per the standards prescribed by the FSSAI. Fortification in the addition of key vitamins and minerals to staple foods such as rice, wheat, oil, milk, and salt to improve their nutritional content and combat malnutrition. About fortified rice initiative background. Initiative launched in 2022 and the 3-phase rollout is out of the scheme was completed successfully by March 2024. Rationale: combating malnutrition. Fortification is a cost-effective method for combating anemia, and micronutrient malnutrition. Higher reach. Rice is an ideal vehicle for supplying micronutrients as it is staple food for 65% of India's population. Schemes cover targeted public distribution system (PPDS), integrated child development service (ICDS), PM portion, formerly the midday meal scheme, and other welfare programs across all states and even territories. Funding: central sector initiative with 100% funding by the center as part of the food subsidy component of the PMGKY. Under PMGKY, free food grains is being provided for 5 years to 81.35 crore beneficiaries of the National Food Security Act of 2013. Thank you. Nobel Prize on Earth. Nobel Prize. Next.